Hello everyone, this is Dr. Huma Ibrar. I hope so you all will be doing well. So today's topic is all about recent Saudi license exam MCQs. And those who are new to this channel, kindly subscribe this channel and don't forget to click the bell icon, as this channel is all about international license exam material and guidance. I'm going to share some important topics of recent Saudi license exam and repeated MCQs that were in exam. So watch this video till end and note down all important points. But before starting this video, I would like to congratulate Sabah for clearing Saudi license exam in first attempt. So let's start the topic. When you treat knee with elevated layer of fat, you can use option A, infrared therapy, option B, ultrasound, option C, shortwave diathermy, option D, TENS. Definition of orthosis, orthotic, orthotist, prosthesis, prosthetics, and prosthetist. Kindly note down all these points. Which muscle do movement of cheeks? What is terminal illness? What is bunion deformity? Name of rotator cuff muscles. What does inflammation of bone is called? All diagrams are important for Prometric exam. If patient's movement is in full range of motion against resistance, which grade it will be? In quadriceps stretching, which muscle is least involved? That is gluteus medius. Inflammation of supraspinatus muscle, supraspinatus tendinopathy. Patient treated by phototherapy. Which of the following modality is used? Option A, low laser, option B, fluid therapy, and option C is ultrasound. Let's move towards next MCQs. Prevention of transmission of pain beyond the dorsal on. Peripheral nerve injury. Option B, gait control theory. Option C, spinal cord injury. And option D is opiate theory. Let's move towards the next MCQs. Baby with flaccid Klumpke's palsy needs stimulation by. Option A, interrupted galvanic stimulation. Option B, reciprocal stimulation. Option C, dynamic. Let's move towards the next question. Electric stimulation, which is not true? Option A, vasodilation. Option B, decreased metabolic rate. Option C, decreased muscle spasm. And option D is vasoconstriction. Let's move towards the next MCQs. Use of can in contralateral hand will. Option A, not affect gait pattern. Option B, reduce energy expenditure in normal person. Option C, decrease the floor reaction force on opposite foot. Option D, not affected floor reaction force on opposite foot. Let's move towards the next question. Most common compression of radial nerve in. Option A, shaft of humerus. Option B, neck of humerus. And option C is distal end of humerus. Next MCQs. Acromegaly is due to malfunction of. Option A, pituitary gland. Option B, thyroid gland. Option C is thymus. So that's all for today. Thank you for watching this video and remember me in your prayers.